see daylight. Now my blindfolds off, I see halos.
I think that you have to continue to change, and the only way to do that is you got to be out servicing people, you got to be in the communities, you got to meet them where they are, and you got to continue to come back and innovate to make sure that you are meeting the needs of your customers.
'Cause you know they will never give up. No, never.
My name is Tamika Hamlin. I'm the Deputy Chief Customer Experience Officer at USDA.
Tamika is the ultimate connector, and her goal is always to understand the root cause and motivator for people in order to help solve problems.
She's a trailblazer. She is absolutely a people person, and she's a go-getter. I absolutely think Tamika embodies listen better, serve better. So it doesn't surprise me that Tamika is winning this award.
It's about understanding the feedback that you hear from the people that you're serving. If you listen better and understand their needs, then now you can serve them better.
Tamika knows that a lot of times decisions are made for people by people who might not even know what those people need or want. And so she really embodies the fact that we should listen before we go and impose our views on them.
I think Tamika's legacy will be creating meaningful change in the lives of citizens, farmers, ranchers, and government employees. She uses all the tools in her toolbox to create meaningful change.
My vision for the future of USDA is embedding customer experience in our DNA. And it's that secret ingredient that we put in everything, right? It's sprinkled on everything, and you don't even have to call it out. It just is.
Take it all, take it all.
Hi, I'm Tashona Beal, a CX strategist at the Department of Defense, Washington Headquarters Services, or WHS, but I'm originally from Brooklyn, New York. I have immense gratitude as a recipient of this prestigious 2023 Service to the Citizen Award Champions of Change. I'm deeply honored to be recognized for my contributions to innovate service delivery and empower employees to own and deliver a superior customer experience. I want to start by expressing my heartfelt appreciation to Martha and the selection committee for bestowing upon me this remarkable honor. Next, I would like to thank WHS leadership for allowing the discovery of CX at our organization. And a great big thank you to the team of people who have partnered with me during this journey. I was a contracting officer for about 12 years in the federal government and then transferred over to the CX world in 2019, where I brought my expertise in acquisitions and lived experiences with my customers. I wanted to make a greater impact on DoD customers from an organizational level rather than a single touch point. In my new role as a CX strategist, I, one, learned how impactful my organization was in supporting the mission of our customers. Two, I saw the broader needs of our customers through the lens of their end-to-end experiences. And three, I started to implement and embody sound foundational initiatives to improve customer trust and promote a human-centered approach at providing exceptional service. Where I've been most proud with these initiatives is developing the first DoD Customer Experience Strategic Development Services, BPA. That was a mouthful. This provided an enterprise pathway for DoD agencies to access more CX and EX services, insights, and knowledge to advance their missions. My goal, to seamlessly integrate EX and CX tools, techniques, methodology, and approach to enhance the customer's experience across the enterprise. My vision is to have CX as a shared service across the DoD and ultimately the federal government. This award is not just a recognition of my efforts, but a testament to the power of collective action. It is a reminder that service to the citizens is not just a responsibility, it's a commitment we make to uplift our communities and empower individuals. Let this award serve as a reminder of the impact we can all make when we harness our collective potential. Again, thank you for this honor and congratulations to the other awardees.
Hi, I'm Evan Albert, Director of Measurement and Data Analytics for the Enterprise Measurement and Design Directorate within the U.S. Department of Veterans Affairs Veterans Experience Office. We are honored to receive the 2023 Service to the Citizen Champions of Change Award, and we also want to congratulate the other recipients being recognized here today. Our team is deeply committed to capturing and analyzing the veteran experience, and the data we collect helps improve those experiences. We envision a VA that's designed around the needs of the veterans and the people who serve them. Our mission is to elevate veterans' voices and identify opportunities to shape processes and procedures around that customer experience, constantly improving the way we serve the community.
I'm Dan Ostra, work for the Veterans Experience Office, been working for the VA for about 4 years now. I'm a Navy veteran of about 10 years in service. By actively seeking out insights and perspectives from veterans and VA employees through our V-Signal surveys and data analytics tools, we're able to help our partners better understand customer needs and design unique solutions to improve trust and quality of care.
My name is Bill Guy. I'm a patient advocate here at the Charles George VA, and I served in the United States Marine Corps for 13 years, from 1991 to 2004. I've been here at the VA now for about 2.5 years almost, and absolutely love what I do, especially here being a patient advocate. The V-Signal surveys allows our medical center to collect, analyze, and track veteran experience feedback from veterans and those that matter to veterans. It's always interesting to me that, whenever we call veterans regarding a comment that they left on a V-Signal, they're usually pretty surprised that we read their comments, much less call them to see if they require assistance.
Chris Montgomery, 21 years, EA. When I responded that it was difficult for me to decipher which appointment was which, I was deeply appreciative of somebody taking the time out to call me back. Like I said, again, together we found a solution.
Hi, I'm Steph Young. I'm the Executive Director of the Western North Carolina VA Healthcare System. We cover 23 counties in Western North Carolina, taking care of our veterans there. So V-Signals, we use that tool often to look for opportunities we may have, to listen to our veterans' comments, and we use them to make changes as needed. We give those compliments to our staff, but also those opportunities to make improvement. It really engages our staff. People look forward to that. They want to know the feedback from our veterans.
We've now sent out more than 75 million surveys, received over 12 million responses, and have helped implement countless process improvement and human-centered design initiatives throughout the VA. What we learn about the veteran experience doesn't end with a single project. Instead, we help create a more veteran-centered VA through continued data collection, analysis, documentation, and knowledge sharing. We are very proud to be part of a team that places our veterans and their families and caregivers and survivors at the center of everything we do. For more information about V-Signals or the other incredible work that our enterprise measurement and design team is undertaking, please visit our website or reach out to the points of contact listed here on the screen. Thank you again.
My name is Margaret Williams. I'm an enrolled member of the Sisseton Wahpeton Oyate of the Lake Traverse Reservation. I am also Keweenaw Indian community from Michigan, and my children are all half Navajo. When I was approached to take this project, I looked at it as a learning experience about boarding schools, like the one I grew up across the street from in Tuba City, Arizona. I was also aware that my father attended Pipestone Indian School. But as we got into the work, and as we pulled down the documents, and as we saw the policies and the procedures and the death records and the attendance records, it became horrific for us researchers, but it also became so obvious why generations of families were impacted, because these children were ripped away from them out of their arms sometimes, out of the schools without their knowledge sometimes, and sent to these schools where they're restricted of their language, their identity, sometimes only called by names, their cultural dressing, and also their companionship. If there were siblings, they couldn't stay together. What this resulted in is a generation of natives that can't speak the language. They're loosely connected to the culture. They're trying to learn. They might have some parenting issues. Now we know where all of this comes from with this project. And we have elders telling their stories for the very first time and releasing that out of their bodies so they can heal. I thank Secretary Holland and I thank Assistant Secretary Newland for their leadership, their support, their strength as they've listened to many of these stories in opening up this boarding school era for all of us to see so that we can heal. And I know Indian Country can heal from this.
Hello, I'm Kathleen O'Laughlin, the Women Veteran Program Manager at the Atlanta VA Healthcare System. It's my honor to receive the Service to the Citizen Award. My role here as Women Veteran Program Manager is to highlight the unique healthcare needs of our women veterans. They are burdened with more physical and mental health needs than non-veteran females. We have a great maternity care program. I work with an incredible team of dedicated individuals that really highlight women's health issues. We're able to do baby showers for our women veterans. And that's particularly helpful because many of our women veterans might not have roots in a support system because they've moved around a lot or they're newly transitioned out of the military. So to be able to work closely with them and make sure that we're providing for their healthcare needs and to also combat some gender-specific issues that we see with maternal mortality and other health challenges, we're able to make sure that our women veterans receive the support that they need. We have been doing our baby showers, but when COVID hit, we were supposed to stop. But what we did is we did a pivot and we were able to do drive-through baby showers so that we didn't expose our expectant moms, but we were able to continue to support them with amazing resources from the community and from our program. So I really appreciate having an opportunity to highlight some of these important health disparities and healthcare needs of our women veterans and to let folks know how important it is to be able to support our women veteran population. So I thank you for this award. I congratulate all of the other recipients and appreciate this opportunity to highlight some of this important message. Thank you.
Hello, I'm Randy Abramson, Product Manager in the Civil Rights Division at DOJ. My pronouns are he and him. I'm 5'10", and I have brown and unfortunately rapidly graying hair. I'd like to thank the Service to the Citizen judging panel for this award, and I'd also like to thank 18F, NAVA, and the Civil Rights Division management team for supporting this redesign of the ADA.gov website. My proudest moments in serving our customers happen when I regularly look at our user feedback about the site redesign. We've heard from users how much they appreciate that we were able to take technical policies and make them easy to understand through plain language principles and create a site that is intuitive and helps the public find the information they need. The feedback we receive, both good and bad, help our teams continue to make improvements to the ADA.gov site. We're thankful for this interaction with the public, and once again, thank you very much for this prestigious award.
Hello, my name is Veronica Williamson, and I work in the Disability Rights section in the Civil Rights Division of the United States Department of Justice. I'm the product owner for the ADA.gov modernization project, and on behalf of our entire team, we just want to say thank you. It was an honor to be one of the recipients of this award, and we want to congratulate all of this year's winners. We launched a new and improved version of ADA.gov with the goal to better assist people with complying with the Americans with Disabilities Act. The ADA is a civil rights law that protects the rights of people with disabilities from discrimination. The Department of Justice is tasked with assisting people in understanding their rights and responsibilities under the law. And one of the ways that it does that is through its website, which is ada.gov. This updated version of ada.gov was designed to more effectively serve the public and to help expand access for people with disabilities. We attempted to do that in a number of ways. This website works well on mobile devices, includes easy-to-use navigational tools, and is written in plain language. One of the things that really excites me about this process was the engagement that we received from the public. Our goal of this project is to be modern, user-centered, and agile. And all along the way, we sought the input from the public. We did user research testing. We have a feedback option on our website where people can leave us information about what they like and areas where they think that we can improve. And so we're not done yet. We're just getting started, and we hope to continue to provide access and information about the Americans with Disabilities Act. Thank you, and have a great day.
So there are so many proud moments of Prepare. We have heard stories, of grief and loss, going through our Helping Endure infant loss groups and being able to heal from the loss of twins in utero. We have had someone going through our Tai Chi and having the lowest blood pressure that they've had throughout their entire pregnancy and postpartum because of Tai Chi that we're offering. Being able to nurse and experience that lactation journey that they never thought that they would be able to. Having the support network in our moms group and that sense of community coming together, knowing that you're not alone, being able to be with other veterans who understand the experience it was and is now that it applies to motherhood. Those are all the amazing pieces that Prepare has offered. It's just really wonderful.
I'm Colleen Wick, and I'm the Executive Director of the Minnesota Governor's Council on Developmental Disabilities. I am honored, humbled, and continue to be surprised at receiving this Lifetime Achievement Award. I began my career in 1972 as a provider of services. As I was opening the case records of people leaving state institutions, I found horrible conditions that these folks had lived in. They were abused, neglected, they had lobotomies, they were sterilized, they were forced to work 6 days a week for $1 a month. These conditions would be called dehumanizing. And I pledged that I would spend my life working on behalf of people with developmental disabilities to improve their quality of life. My career has included being a provider, a researcher, and in my current position for 42 years. I have worked at all levels of government to improve the lives of people with developmental disabilities, including the legislative branch, the judicial branch, and the executive branch. When I began, there were 6,565 people with developmental disabilities living in our state institutions. And over time, we were able to move all of those individuals into community placements. The last person who left the institution was in July 2000, and that was a memorable event. In 1987, I helped create a program called Partners in Policymaking, which is a leadership training course for people with disabilities and for parents of young children. We spend 8 weekends together learning best practices as well as how to communicate with local, state, and federal officials. This is a second memorable moment for my career. Today, we have over 1,160 graduates of this leadership training program in Minnesota and over 29,000 graduates nationally and internationally. Thank you for this award, and please remember to treat people with respect and dignity and include people with disabilities in all aspects of community life. Thank you again.
Hello, I'm Marietta Jelps, Product Manager of USA.gov and USA.gov in Espanol within the U.S. General Services Administration. I'm proud to represent the entire USA.gov platform today, which also includes our bilingual contact center and our public outreach channels. In April of this year, USA.gov launched reimagined versions of our websites that put people first. As the federal front door, we've streamlined the process for the public to find and use government information that they can trust. The improved experience isn't limited to just our website users, though. Our new navigation and structured content also make it easier for our contact center agents to find and provide correct answers to people who call or chat with us. And it makes it possible to share the most contextually relevant content with our social media followers and email subscribers. We're proud to say that people are at the forefront of these websites. We've designed them with them in mind, focusing on their needs based on data from usability tests, website surveys, and online searches. And data has also led us to experiment with interactive content. For example, our Contact Elected Officials tool aggregates contact information for elected officials at all levels of government to deliver personalized lists to our users based on their address. In just 5 months since launch, early data has validated that our new approach, answering just one question per page, using descriptive hyperlinks, embedding the U.S. web design system throughout the site, is improving the public's experience. Both quantitative and qualitative data point to better outcomes and referrals than our previous sites, which is very exciting. We know that navigating government can be confusing and it can be complicated. So it's been so gratifying to see evidence that our collective effort makes it easier and faster for people to access the information they really need when they need it. And now to be honored for that work with the Service to the Citizen Award is beyond anything we could have ever expected. We're truly humbled. On behalf of the entire team that powers USA.gov, I say thank you.
Congratulations to our team in the Web and Emerging Technologies Group within the CMS Office of Communications for being selected for the 2023 Service to the Citizen Award. I am so proud of the outstanding achievements of this team in managing and operating complex platforms that provide essential healthcare services to millions of U.S. citizens. We are entrusted with the responsibility of overseeing the federal Medicare consumer website, the federal healthcare exchanges, and supporting systems, which collectively serve tens of millions of users and beneficiaries. I'd like to express my immense pride in the remarkable progress our teams have made transforming the Medicare.gov and Healthcare.gov websites in recent years. Through our unwavering commitment to quality and innovation, we have harnessed modern tech stacks, industry-leading cloud and software delivery tools, and cutting-edge cybersecurity practices to deliver value to our citizens and improve healthcare in the United States of America. This award acknowledges our past accomplishments, but also serves as a catalyst for even greater achievements in the future. Together, we will continue to embrace the challenges that lie ahead, leveraging our technological prowess and unwavering determination to drive positive change and provide superior healthcare experiences for U.S. citizens. Thank you.
Hello, my name is Devaney Nichols, and I am an IT security specialist at the Centers for Medicare and Medicaid Services. I serve in the Division of Website Operations under the Office of Communications, Web, and Emerging Technology Group. As an IT specialist, we work behind the scenes in aiding in and supporting the distribution of healthcare services to millions of Americans. Our work supports the accessibility, availability, and simplicity of the navigation of the federal healthcare websites, including Medicare consumer websites. We are able to support and serve the healthcare industry users, and most importantly, the healthcare beneficiary communities. I am extremely proud to know that the work that I complete on a daily basis has such an impact on so many, especially in their times of need. I often reflect on my grandmother the late Janet George, who was an incredible, independent, and loving woman that I always referred to as Wonder Woman. When she became ill as a beneficiary over the years, I felt a great sense of pride knowing that the work I performed behind my desk impacted my grandmother's journey until she transitioned. To serve, to affect, and to impact the beneficiary community, not as a healthcare professional, but doing my part as an IT security specialist, brings me great gratification and pride. I am honored to be a part of this team, and we truly appreciate being recognized by this Service to the Citizen Award. Thank you.
Mark and I are privileged to lead the team that runs healthcare.gov, the federal marketplace that enables Americans in 33 states to purchase affordable, quality health insurance. This year, over 12 million consumers selected plans on our marketplace, an all-time high number representing a 50% increase over 2 years ago. Not coincidentally, the number of uninsured Americans also reached an all-time low. We achieved these results by making steady improvements along with a monumental change.
Key technology improvements over the last few years include moving to a modernized API-first technology platform, shifting our systems into the cloud, and simplifying the application experience for consumers. The combination of these key initiatives and others has improved resiliency, performance, and enhanced our ability to quickly respond to emerging consumer needs with the marketplace. In short, we can deliver more technology more rapidly and with higher reliability, ensuring a continuously improving consumer experience.
We recently had a unique opportunity to expand coverage coupled with a challenge. The American Rescue Plan Act provided unprecedented levels of financial assistance to people purchasing coverage through the marketplace. Health insurance tax credits covered more people and at greater generosity levels. Overall, premiums for federal marketplace consumers decreased by over 45%.
The challenge was that we needed to update eligibility rules to provide this enhanced assistance. With our modernized platform, we were able to make the subsidies available to consumers about 3 weeks after the American Rescue Plan was signed into law.
And 6 months into the new administration, we had 2 million more enrollees and a total of 10 million Americans benefiting from this new affordability. We want to thank the team of federal employees and contractors who worked hard to make this all possible.
Thank you, Service to the Citizen, for this acknowledgement. My team and I have had the privilege of working at the U.S. Food and Drug Administration that's filled with amazingly bright and dedicated people that's focused on the mission of protecting the public health. Over the last few years, my team has made a proactive effort to work on improving FDA's employees' experience with technology and communications. Our strategies are built on continuous improvement that deliver better enterprise capabilities faster and that are less disruptive to the workforce. This program had unintended benefits as well. Our internal team was able to take this capability and use it as a project manager incubator, a place to take actions on lessons learned, and an understanding of organizational factors that would normally cause major delays or even derailment of a project. These improvements have led to major successes and has started shifting our culture, allowing the team to be more ambitious. We all know how difficult change can be. This is how it always has been done as a really persistent mantra. But our persistence of keeping our eye on the end goal, listening to feedback, and humor gets us through. As we move along this continuous improvement journey, we try to follow Peter Drucker's wise words of, there is nothing so useless as doing efficiently that which should not be done at all. Our journey is far from complete, but it's nice to take a breath and be recognized for the hard work we'll continue to do at the FDA. Thank you for this recognition.
Hello, I'm Suzanne Klinker, Deputy Network Director for the Clinical Contact Center in VISN 8. Thank you for this award. It's my privilege to lead an organization that honors America's veterans with 24/7, 365 access to healthcare and services. We provide clinical triage, scheduling and administration, pharmacy, and virtual clinic visits with medical providers around the clock to veterans in Florida, Puerto Rico, and the U.S. Virgin Islands, now having answered more than 7 million calls since 2019. We work as a team with a veteran at the focus of everything that we do, and our team of nearly 700 employees enjoys an all-employee survey Best Place to Work score of 90. Thank you.
Hi, everyone. My name is Saranda Silva.
Hi, my name is Ashley Fortuna.
We are speaking on behalf of the web redesign team at the Social Security Administration. We are honored to receive a Service to the Citizen Award. The redesign of the SSA.gov website is not just a technical update, it's a testament to our commitment to improve the experience for our customers. This improvement represents a significant step forward in how we interact with the people we serve.
A core Social Security value is to ensure that everyone who needs our services can access them. We reimagined the website consistent with the feedback we heard from our customers. Now it's easier to navigate and obtain key services. Social Security's programs are complex. A pillar of this redesign is clear communication. Our use of plain language helps ensure content is understandable, and this approach allows the public to be empowered and informed.
I'd like to share a proud moment serving our customers. During one of our many usability testing sessions of the site, we met with an individual struggling with questions and concerns about their Social Security benefits. We watched them use the redesigned site and witnessed their relief and excitement as they successfully navigated to answers. This was a reminder of why we do what we do.
We thank everyone who gave feedback to ensure the redesign reflects their point of view. Citizen-centered design is at the heart of improving the customer experience at SSA. This award tells us we are on the right track to better serve the millions of people who come to us for help.
Congratulations to all the other award winners. It's an honor to be recognized with you.
Hi, my name is Jose Bejarano, Director of IRS.gov at the Internal Revenue Service. Did you know that millions of people use IRS.gov and online tools to file, check refunds, pay taxes, and get answers to their questions? While our goal is to make taxes easier to understand, taxes remain a fairly complex and sometimes nerve-wracking topic for most of us. Now consider the additional challenge you'd face if you weren't confident understanding English. Wouldn't it be easier to understand taxes if the information was offered in the language you're most comfortable with? Providing information in the language taxpayers prefer requires expanding and improving online options and interactions on IRS.gov. More than 100 IRS Service to the Citizen Award nominees dedicated their time and talents and collaborated extensively to expand services to taxpayers with limited English proficiency. To make digital products and services accessible for those taxpayers, we translated and published hundreds of multilingual terms, web pages, and application screens as part of our strategy to translate and issue the top 20 IRS notices in 5 different languages. Their exemplary efforts have dramatically increased the availability of information to taxpayers and improved the taxpayer experience and the accessibility of tax information and services for underrepresented taxpayers. Last year, there were more than 40 million visits to non-English pages on IRS.gov, and we published more than 18,000 multilingual pages. Today, cross-functional teams across the IRS continue to find innovative ways to improve the taxpayer experience by providing online products and services in more languages. I am very proud of the work we have done and continue to do at the IRS to improve the taxpayer experience. On behalf of our amazing team of dedicated transformational leaders, thank you for honoring us with the prestigious Service to the Citizen Award.
Hi, our team is excited to be a winner of the Service to the Citizen Award. The IRS Information Returns Modernization Program, also known as IRMOD, is a multi-year program focused on enhancing the taxpayer experience through a user-friendly, cloud-based portal for the electronic filing of information returns. We delivered this portal, called the Information Returns Intake System, or IRIS, in January of 2023, and we're excited to see how it's improved the experience of small businesses and other filers.
More than 4 years ago, the Taxpayer First Act legislation was enacted to broadly improve the way the IRS works, and from there our program was born. The law required us to deploy the new portal by January 2023 for small businesses to electronically file Forms 1099. They can file with real-time accuracy and use an expanded set of new self-help services to save time and alleviate administrative burden.
In the run-up to launching the portal, we saw a real opportunity to modernize the way every information return is filed with the IRS. We've set our sights on expanding use of the portal for all information returns, not just 1099s.
So let's talk about the numbers. Since January, nearly 4,000 filers, mostly small businesses, have used the portal to complete more than 67,000 submissions. We've got momentum, and we're continuing to see our numbers grow.
And over the next several years, we are increasing the efficiency of our information returns processes by retiring legacy systems and improving our customer service. It has really been a team effort.
We are honored to be part of the 2023 Service to the Citizen Award. Thank you.
Imagine that you're driving down the street one day, going about your life, not thinking there's anything wrong, and just being plucked out of your everyday life for 15 days. Is your employer going to keep your job open for you? Is your landlord going to let you keep occupying the space without paying rent? The reality is, for our clients who are usually living so close to the edge, that can be devastating. Anything that helps us save time to represent our clients more efficiently and be able to get them out of custody quicker is beneficial for everybody. Public defender is someone who represents someone usually when they've done the worst thing they've ever done in their life, and our role is to show who that person is and not what it is that they did.
The LA County Public Defenders is the biggest and the oldest public defender's office in the United States. The Public Defender's Office was caught, like many of these legal organizations, kind of stuck in the past. We had an exclusive paper case file system. Cases would stack up in people's files, file cabinets on their desks.
When we're on a paper file system, everything is reliant on the system working. Oftentimes files would be misplaced, they would be hard to find.
We had to modernize our case file system. I mean, we really had no choice in it.
What this office needed is a technology consultant. We needed a partner to create a digital twin of a 110-year-old organization.
As a client executive, my primary responsibility is to lead the response effort for any RFPs that come out. I remember working with the Salesforce account executive talking about going after this. I realized that the LA County Public Defender's Office could be the poster child for criminal justice management's digital transformation.
It takes someone who understands the technology and understands the questions that need to be asked in order to kind of pull out those needs from the client and then translate it back to programmers.
It's fascinating to see all those developers become experts in the criminal legal system.
There was so much more to it than I ever imagined.
So I would meet the client at the first appearance, take down their information, fill out the green sheet or the yellow sheet.
How many different routes a different case or a client can go.
And go through the arrest report with them.
Depending on the charge and depending on the type of person, whether they're an adult or a child.
I have served as a therapist, I have served as a friend.
Whether mental health issues.
I have served as a social worker.
They have to know so many things.
As a guidance counselor. you name it. Our biggest goal
The sooner someone
is
is
for our clients to come out of the
system,
without coming back.
the less likely they're going to be to return to the system.
That's the fight.
At a very granular level, all the information that is now stored in CCMS allows the lawyers and support staff to access the digital case file at any time from anywhere. And it has improved the quality of client representation because you have the client's really complete information at your fingertips. And that was never the case prior to CCMS. On a macro level, it helps us identify trends.
We want less people to fall into the criminal legal system and be more proactive and provide alternative to incarceration. It's all about using data to correct the record and to show value of who we are and what we do.
About a year ago, I had a client who was suffering from mental health issues, and we were able to get him a probationary outcome on his case. He was doing really well, but because the court was concerned about his progress, we continued to have court dates every couple of months. He also had to check in with probation once a month. And one day I noticed that his case was on the list for the following week for a possible violation of probation. When the probation department creates a report, it automatically feeds into CCMS. Contact had been lost between client and his probation officer. Pre-CCMS, there's no way I would have known about that. I used CCMS to get a hold of our client that same day. And so that next week we went to court. He showed up with the necessary paperwork and the judge calling the case with the expectation that she was going to issue a warrant for him. And I'll never forget the expression on her face when she saw that he was standing next to me. And the judge just took the matter off calendar. What would normally have happened pre-CCMS is that same probation officer would have written that report and the court would have called the case, called out his name. He wouldn't have been there because he didn't know. And the court would have issued a bench warrant for him. And he would then be arrested. The judge would keep him detained on a no bail warrant for at least 2 weeks for the probation department to do an investigation. He would have lost his job that he had just gotten. He would have lost his apartment because he wasn't there to pay rent. His car probably would have been repossessed because he wasn't working and able to make that payment. I mean, things like that happen. They're now avoidable when they weren't before. CCMS continues to evolve. We've been using it for years now, and I can tell you just before I came in here, we got an email about a new feature that's being rolled out.
The thought that this type of system could be used in other cities and impact more lives is really inspirational.
Technology advocates like myself in public sector, they don't only advocate for efficiency, cost saving, and paperless, but they advocate for a much larger return of investment, which is helping people and in bettering their lives.
Good morning. I'm Dr. Rakisha Stewart, Division Manager with the Housing and Neighborhood Services Department with the City of Charlotte. And when I think about this past year, it's something that I'm very proud of. One group that I oversee, CHARMEC 311, we're the primary point of contact for the city and for the local county, which is the County of Mecklenburg. During the pandemic, we realized there were tons of resources that were being offered by the city and by the county and even by federal government. But there were just some residents of our community that just not have knowledge or information or access to these resources. So we actually took the time to create a new initiative called 301 On the Go. And the goal was to meet people where they are. So we actually went out into the community proactively to ensure that they were aware of these resources so that we can make sure that we lived up to our vision of, changing and impacting lives one interaction at a time. So grateful to 301 On the Go as we were able to provide information on breaking the digital divide, empowering financial literacy, rental, mortgage, and utility assistance, and a vast of other resources. So grateful and thankful that I was chosen to lead CHARMEC 311.
As the program lead for Booz Allen's support to recreation.gov, I'm proud of the innovative approaches and modern technical solutions that my team delivers to land management agencies and field staff across the country. We're solving mission problems around resource protection and stewardship while also helping our citizens enjoy the parks, forests, lakes, and museums that are such an important part of American life. One example of our approach in action is how the team used innovative technology, agile methodologies, and human-centered design to help our government clients at the Bureau of Land Management find a new solution to replace the manual process for the high-demand Coyote Buttes North Daily Lottery, otherwise known as the WAVE.
As the product lead for our recreation business, it's the best feeling knowing how our product is enabling staff at public lands to spend less time in front of their screens at their desks and more time outdoors engaging with visitors and managing their locations.
As the technical lead for our team, I'm always impressed with the integration and collaboration between our teams and clients. As an example, for the WAVE, the land managers and local gateway communities were concerned that an online solution would reduce visitation to the field office locations and detract from the local economy. Placing the user, field staff, and visitors at the center of the technical design solution, the team deployed a geofence technology in the recreation.gov mobile app to trigger the lottery application process for visitors who are within the defined perimeter to encourage travel to the gateway towns.
For the WAVE and other places like it, our innovative solution provides the facility staff benefits such as reducing the time needed to manage a high-demand in-person application process, reducing the risk and burden of processing cash and check payments, providing access to data to track visitation and trends, and easing the efforts of crowd management.
This is just one example of how our passionate and committed team works with clients every day to address their biggest challenges and opportunities. We're proud of what we've been able to accomplish with our federal agency partners for recreation.gov, and we're excited to use digital technology to improve access and connect visitors with our public lands and waters.
Hi, I'm Christy Choi, Deputy Director of Communications at Health Resources and Services Administration, also known as HRSA. We're very thankful and honored to have been selected for a Service to the Citizen Award this year. At HRSA, our mission is to make sure people in underserved communities receive affordable and high-quality health care, regardless of their ability to pay. With me today are the members of our digital team.
I'm Rich Morey. We meet HRSA's mission by funding health centers that serve more than 30 million people across the country. We also keep an eye on the health workforce and provide loan repayment and scholarship programs to health professionals to prevent shortages. Most of these folks interact with HRSA through our websites.
Hi, I'm Roxanne Bihari. We are in constant contact with our partners and house experts to identify ways which we can make our websites better. So when we're able to make improvements, as we did this past year, and confirm our results, it's gratifying because we know we've made things a little easier for that health clinic in rural Pennsylvania or that medical student in Georgia.
And that, in turn, means our partners have that much more time and energy to devote to the people who walk through their door every day who need health care. I'm Siobhan Keenan, and that's what it's all about. That's why we'll never stop working to improve.
In closing, thank you from all of us on the digital team, including team members who couldn't be here today, Mackenzie Cummings, Francis Wang, and Kyan Chung. I'm very fortunate to be working at HRSA. I want to thank everyone for their support and dedication. Congratulations to all the award winners. It's an honor to be recognized along with all of you. Thank you very much.
We are deeply grateful for this recognition, which reaffirms the value of our work for the WIC program. For almost 2 decades, GCOM has remained at the forefront of driving technological innovation in WIC. Its web-based application helps WIC staff provide efficient, effective services to WIC participants by using state-of-the-art technology, experienced developers, former WIC staff, and subject matter experts. GCOM serves 13 WIC state agencies, 1 territory, and 10 tribal nations. Its solution supports 3 million WIC participants nationwide, which is nearly half of all WIC participants. Our team supports the Maryland WIC program. Last year was a particularly stressful time when a recall by baby food manufacturer Abbott Nutrition, combined by global supply chain issues, created an extreme shortage of baby formula. In the face of this shortage, every member of the GCOM team stepped up to support and work together with our customers to expand the types of formulas available for participants on very quick timelines. We rapidly modified the WIC system and the WIC mobile app to make the new formulas available. By quickly updating the WIC system, we were able to minimize disruption and improve access to baby formula for participants we serve in Maryland and nationwide. We are proud to have helped low-income mothers and vulnerable infants remain healthy during a tremendously uncertain and challenging time. Our work is more than technology. It's about empowering lives. This award validates our purpose, our capacity to make a meaningful impact, and our unwavering commitment to service. Thank you.
Hi, I'm Amber Chowdhury, currently the CX lead at the Department of Housing and Urban Development. On behalf of HUD CX team, the Office of Disaster Recovery, and the Office of Public Affairs web team, it is truly an honor to receive the Service to the Citizen Award for helping disaster survivors gain access to government resources on HUD.gov. In the wake of a disaster, survivors are left to rebuild their lives, all while dealing with the trauma of a devastating loss. Our team set out with the goal to make that painstaking process just a little bit easier. This project was a shining example of cross-functional collaboration at its finest. We got feedback from the new design from across the department, disaster survivors, and partner organizations to help ensure that the website was easy to use and understand, allowing survivors to find the information that they needed as quickly as possible. The finished product is a result of work from a committed team, and we hope will help empower survivors to regain control of their lives. A big congratulations to the team and other award winners. It is an honor to be recognized alongside each one of you all.
Hello, my name is Dr. Greg Rieger. I'm a clinical psychologist and the Deputy Associate Chief of Staff for Mental Health here at VA Puget Sound. I'm also a professor of psychiatry and behavioral sciences at the University of Washington School of Medicine. As a psychologist, I served not only here at VA, but previously on active duty with the Army. I'm a veteran and had a front row seat, if you will, to observe and try to support service members who were encountering the stress of doing their very difficult work serving this country in a deployed environment. It transformed how I thought about my career, and ever since I've leveraged my research skills to try to support service members and veterans by designing and evaluating technologies that might help them access mental health services in a more convenient manner. This has included everything from virtual reality environments to mobile applications. Currently, we're working on evaluating a mobile application that might help veterans really benefit from the psychotherapy that is an evidence-based treatment for PTSD. Far and away, the most rewarding part of this work is when a veteran uses a technology they don't even know I had a hand in designing, and lets me know that it really made things more convenient for them, or maybe their perception of the Department of Veterans Affairs has improved because of its willingness to invest in a helpful technology like they experienced. All of my work has been in the context of teams, and certainly I view this award as to an entire group of colleagues over many years who've collaborated on this kind of work. Thank you for the honor. I appreciate the recognition, and it will spur us on to more innovation on behalf of veterans.
Hello, everyone. I'm Dr. Ann Udick from the U.S. Department of Veterans Affairs, Veterans Health Administration. Here at the VA, I am honored to serve as the National Executive Director for Nutrition and Food Services. The VA Nutrition and Food Services program is made up of approximately 10,000 proud federal nutrition professionals who prepare and deliver all the meals to veterans staying with us in VA Medical Center inpatient and rehabilitation units and our community living centers. Our service also delivers all the clinical nutrition care for veterans through our registered dietitian nutritionists and clinical diet technicians. The governance for our office is administered through our Nutrition Field Advisory Board. These nutrition professionals who, for whatever reason, wake up each morning wanting to do more and grow programs, policies, and solutions where I think they need to be, closest to the veteran and in the field. Everyone needs nutrition. Food thermodynamically fuels our bodies, but it is a real connection and opportunity of stewardship and respect for our land, animals, and environment. It is the table where science, art, culture, and love all come to dine with the human experience. Nutrition is communion, sustenance, the bond between mother and child, time for families to gather and strengthen, and heals and improves performance. I am humbly grateful to our veterans for their service and sacrifice to our country. They have taught me so much about service and mission, and commitment to their nutrition and well-being is my greatest honor. I hope that each veteran and each nutrition professional finds moments of joy and empowerment around their food choices and food experience, and that they also find each other to feel supported in their journeys. Notification of this award was a complete surprise to me, and I want to say thank you to the nomination team, Service to the Citizen, and all fellow recipients. I can say that you've really made a difference for me by offering this encouragement and opportunity to share our VA Nutrition and Food Services program. Thank you.
Hi, my name is Alex Sripapatana, and I'm humbled to be a 2023 Service to the Citizen Award recipient. I oversee the Data and Evaluation Division for the Health Resources and Services Administration's Bureau of Primary Health Care. HRSA is responsible for administering the Health Center program. Health centers are the vital source of primary care for more than 30 million people across the country. They provide essential preventive and primary care services, including behavioral and maternal health in some of our nation's highest need communities. My team leverages health center performance data, such as screening rates and patients' access to services, to advance and improve healthcare delivery at over 15,000 community health centers nationwide. My mission is to do everything I can to ensure that health centers are places where I would take my mom for care. Speaking of mom, I remember the day I told her I wanted to go to public health school to pursue a doctorate and become a researcher. Her response? So you want to be a doctor? To this day, I still don't think she knows what I do, but that's okay. I work with hundreds of committed civil servants who ensure that medically underserved communities have access to high-quality primary health care services and a fair shot at the American dream. I firmly believe that good health is the cornerstone to achieving that dream, regardless of where patients come from or their health insurance status. I'm proud of how our work helps patients access health care that is equal to or even better than care delivered in any other primary care setting. To me, this means my team's charge is to tell the important stories of health centers and their patients through the data that they share with us. After all, each data point represents a unique life and someone's care journey. HRSA's recent work to modernize how health centers report their data will continue to deepen the health center program's story. We're harnessing advances in health information technology to better capture more detailed data, like health status, race, ethnicity, sex, gender, and housing status, that influence patients' care-seeking behavior, care received, and health outcomes. When we do this, HRSA can better articulate how millions of patients access healthcare services no matter their zip code, preferred language, or socioeconomic status. Our efforts will continue to improve the Health Center program through enhanced data-informed decision-making and help achieve my goal that if my mom goes to a health center for care, she'll be treated with respect, with the best care available, and in a way that will make her want to return for future care.
Hi, I'm Bryn Cole. My pronouns are she and her, and I currently serve as the Director of Design and Storytelling within the VHA Innovation Ecosystem. I have been a VA employee since 2008 and have held a lot of different roles across the organization. But one thing has always been what drives me, the belief that healthcare is, at its core, simply about people taking care of people. When the COVID-19 pandemic struck, my team and I saw an opportunity to leverage the pandemic as an inflection point, to pause, reflect, and reimagine what VA could be, grounded in the human perspective We embarked on a large-scale human-centered design project we decided to call Reimagining Veteran Healthcare. We met with over 250 veterans, caregivers, and VA employees from across the VA landscape to listen and learn about the issues they experience. We sat on veterans' front porches in Los Angeles, in backyards in Houston, and zoomed into living rooms and offices all over the US. It was remarkable, the openness and trust that vets and employees placed in us. I will forever be grateful and will never forget it. After listening to and learning from everyone, my team and I worked with even more veterans and employees to co-design new ideas and are actively piloting some of the solutions right now. When we incorporate veterans into identifying problems and then designing solutions, we create services that exceed expectations, restore hope, and build trust within the veteran community. Thank you to my colleagues who have encouraged me to be bold. Thank you to my boss, Kit Teague, for always believing in me. And thank you to the many humans who shared their stories and experiences with me and my team. And thank you to the Service to the Citizen Awards program for the recognition.
Hi, I'm Danielle Hagen, a diffusion specialist with the Veterans Health Administration Innovation Ecosystem Diffusion of Excellence team. As a diffusion specialist, I have the unique opportunity to support innovators across the Veterans Health Administration as they bring their innovations to the masses, both in VHA and in the private sector. It is an honor to work with such talented individuals and teams. The surgical pause is one of those innovations that started small in one VA medical center when a provider noticed an increase in mortality rates among veterans undergoing elective surgeries. Research shows us that there is no such thing as a low-risk surgery in high-risk frail patients. Historically, there has been no reliable way to identify the highest risk patients at the point of care before enacting a surgical plan. The surgical pause addresses this critical issue through two steps. 1, measuring patient frailty. And 2, doing something about it, whether this is through prehabilitation measures or non-surgical interventions. The surgical pause allows us to mitigate known risks and align with the long-term goals for the veteran. The surgical pause was a winner of the 2019 VHA Shark Tank competition, and I have had the privilege of working with the team to scale this innovation across the largest healthcare system in the country. We have developed multiple tools that support ease of adoption and also allow us to measure the impact of this outstanding practice. In the last 3 years, we have been able to take this practice from 3 sites to more than 50 through our strategic partnerships with national program offices, academia, and field-based providers. It is with sincere gratitude that I thank my colleagues for this nomination and the Service to the Citizen Awards Committee for this recognition. Thank you very much.
Hello everyone and good afternoon from Tampa VA Hospital, Florida. My name is Indra Sandal and I'm a Chief of Innovation at Tampa VA Hospital and National Lead for the VHA Uber Health Connect initiative. I'm honored and grateful to receive the Service to the Citizen Award for this program. Transportation, as you know, is the largest barrier to healthcare access for our veterans. So this program, which is a VHA Uber Health Connect initiative, reduce the missed appointment, no-shows, improve their experience so that they can come on time for the medical appointment and also do the cost saving to the VA hospital. The most important thing about this program is to improve the veteran experience. To talk a little bit on that, I have with me Mercedes, a veteran who gets the Uber Health to come to the medical appointment to Tampa VA Hospital, and he's here.
Hi, my name is Francisco Mercedes. I'm a veteran for the United States Navy, 6 years. It's very comfortable to know that you could wait at your house for the Uber because they come and pick you up right in front of your apartment, and it's convenience, it's comfortable, and I haven't had a bad experience. There was times when I couldn't make it and I didn't have the money to take the bus, so I had to cancel my appointment. But being able to have an Uber, and whether I have 3 or 2 or 4, I could make it because the Uber comes and picks me up and drops me off. Basically, you go to your appointment, you take your Uber, you don't have to pay anything. And I know there's a lot of veterans that can afford to be paying out of pocket all the time.
I want to express my gratitude to all the veterans who are participating in this program. We are hoping that we are making a change by bringing you on time for the medical appointment. And also thank you to my team, especially to the co-lead of this program, Ben Williams, Veteran Transportation Program Office, Vision Network Leadership, and the executive sponsors, mobility managers who are helping every day our veterans to bring them on time for the medical appointment. Thank you, everyone.
Hi, my name is Eris McCautry-Gill, Executive Director for Employee Experience and Organizational Management at the Department of Veterans Affairs and the Veterans Experience Office, and along with Laura White, Chief Wellbeing Officer at Health and Human Services Administration for Children and Families, we are so proud to have received the Service to the Citizen Award for establishing a government-wide employee experience community of practice. I'm standing today in front of the White House as part of a community of over 2 million public servants in the executive branch who provide a wide array of critical services to the American public. From defending our national security to responding to natural disasters, caring for our veterans, their families, caregivers, and survivors, and protecting public health and the environment. Creating easy, effective, and emotionally resonant experiences for our team members across the federal government is critical to improving customer and employee experiences, and it's the right thing to do. We know that it's really hard to have the best customer experience without an excellent employee experience, and we established the community of practice to support a cohort of government professionals who are passionate about EX to identify and co-solve problems in the EX space, learn and teach, and network with one another in an effort to really ignite and bake EX into the DNA of all of our agencies. A huge thank you to our respective teams who work tirelessly on this mission, shoulder to shoulder with us. And again, thank you to Service to the Citizen for this wonderful recognition.
Hello, my name is Gary Olson, and I am the Deputy Executive Director of the Talent Management Directorate at U.S. Customs and Border Protection. I want to thank Service to the Citizen for this recognition and the work they do to support our citizens and the public service mission. When I think about how CBP's Human Capital Organization supports the citizen, I think about how we hire heroes. As a retired Armored Colonel with over 40 years of government service, it gives me great pride that our law enforcement ranks are comprised of nearly 35% veterans. Every day we look to grow our workforce with individuals of all walks of life that have chosen to make public service their life's mission. The anecdotal feedback we've received from applicants is they want more digital touch points, self-service functions, and more information about each step in the hiring process. To transform our hiring process and provide our applicants with a more personalized and customized environment, we created the Ultimate Applicant Experience. The Ultimate Applicant Experience includes a suite of digital products such as hiring overview videos, day-in-the-life videos, an augmented reality app, a video of what to expect at our law enforcement academy, and virtual interviewing and examination technology capabilities. These resources are aimed at better informing our applicants and giving them the tools to navigate CBP's hiring process. We want to maximize the accessibility and visibility of CBP's opportunities to all citizens, and these resources are dedicated in accomplishing this task. At CBP, our goal is to provide applicants with complete access to every piece of information they need to make the best decision they can for themselves and their career journey. We understand CBP's mission requires a significant effort and commitment from those who choose to pursue opportunities at our agency. Our applicants' willingness to make this commitment is what has inspired the Ultimate Applicant Experience and the work we do to support them every day. Our efforts have allowed us to provide a better citizen experience to the nearly 8,000 hires we make in a year. I am honored that I play a small role in the delivery and facilitation of the Ultimate Applicant Experience, but the success we have accomplished is the result of countless individuals' time, effort, and commitment to our country and our citizens. Thank you.
Hello, my name is Drew Sidlinger. I'm the Program Manager for the Transportation Security Administration's Transportation Worker Identification Credential Program, commonly known as TWIC. I'm joined today by TSA Program Analyst Joshua Wan. We are pleased to highlight the TWIC program's contribution to improving the DHS customer experience through an online renewal process. The TWIC program is a joint DHS security program established by TSA and the United States Coast Guard in 2007. TWIC mitigates potential maritime security threats by requiring individuals to complete a security threat assessment. Individuals who successfully complete the assessment are issued a biometric transportation security card, a TWIC card. On a daily basis, more than 2.2 million TWIC cardholders use their credential for unescorted access to ports, facilities, and vessels across the United States.
The TWIC program's efforts begin at enrollment, where TSA collects data to vet individuals based on confirming their accurate identity. The enrollment process requires workers to complete an in-person visit to one of more than 500 enrollment centers nationwide. During enrollment, applicants provide biographic and biometric information such as fingerprints to TSA's enrollment provider. The requirement to positively identify the applicant in person poses certain time and cost burdens. In-person renewals require individuals to take leave from work or allocate personal time to complete the process. Some individuals who reside in remote regions commute at lengthy distances of 2 hours or more to visit an enrollment center. TSA identified an opportunity to reduce the total burden on workers by way of a secure online renewal process. On August 11, 2022, TSA implemented TWIC online renewals. This important capability enables eligible applicants to renew online without visiting an enrollment center, resubmitting biographic information, or paying the full enrollment fee. Since this was established, 80% of TWIC renewals are now completed online, saving the public and employers nearly 80,000 burden hours. These burden reductions allow drivers and mariners to continue working in support of our nation's supply chain. On top of the time savings, online renewals resulted in an $8 reduced fee, saving applicants nearly $900,000 since August 2022.
TWIC online renewals provided a critical and timely contribution to maritime security and U.S. supply chain operations. Over the past year, TSA received positive feedback from key stakeholders, such as the American Waterways Operators and American Trucking Associations. Most importantly, we are thrilled to hear from the workers themselves, who are the primary beneficiaries of a more efficient TWIC program. TSA and the TWIC program are proud to have contributed to DHS's achievements in efficiency, equity, and accessibility. Thank you.
Thank you.
I'm Tricia Civic, the Principal Deputy Assistant Commissioner for the IT category here at GSA. I'm so thrilled to get this award, and it represents so many collective efforts by my talented colleagues in GSA. Helping agencies provide citizen services really is core to our mission. My team connects our customers to highly qualified companies who supply the IT solutions that the agencies need. And our impact is pretty broad, to the tune of $35 billion annually, which is nearly a third of the government's annual IT spend. When it comes to customers, we're constantly saying, your mission is our mission, and we do mean that. I'm really proud to drive a culture and work with my team to continually integrate CX principles throughout our 650 plus employees in our organization. Gradually, our lens did broaden. Our process improvements and CX focus have a broad impact, not just on customers, but also on thousands of industry partners and our own internal employees. We applied a more purposeful convergence between customer, industry, employee, and digital experience, all with the broader goal of improving the total experience for all of our citizen stakeholders. Delivering the best total experience through this framework is really what drives me and my team every day. I couldn't be more proud of the work that we're doing.
Grants Quality Service Management Office is the one office in government that reaches across the entire federal enterprise, working with all awarding agencies and all applicants and grant recipients to bring and offer better tools to help them deliver on their grants mission and truly transform what's possible with the over $1 trillion a year in federal grants that are awarded.
The initiatives that I'm most excited about that our Grants QSMO team is in the process of championing and looks forward to doing work on would be the expansion of our marketplace. Our Grants QSMO marketplace is intended to be a catalog and a storefront of quality, innovative, shared solutions and services for federal agencies that do work within the grant space to utilize to be able to do their work and execute on their mission and ultimately get the money out the door to the intended recipients. We are working to expand on what is currently available to federal awarding agencies, the tools, the solutions, the systems to be able to do that work.
I found in my years of public service that there's 3 P's that matter. 1, passion, which you've got to have to keep doing the work. And luckily for me, I know the impact we make every day, all the way down to the American taxpayer. The second one is partnership. We have an amazing team of federal staff, of federal providers, vendors that we work with, Guidehouse and Medallia, for example, as well as recipients that every day will provide us feedback and let us know where we can improve or where we're doing things right. And lastly, perseverance. There's a lot of roadblocks and you cannot get beat down by those. You have to keep going because at the end of the day, what we're doing is really important. It is building those bridges, getting money to schools, helping to make medical innovations that drives vaccines or other improvements across the world. So with those 3 P's, passion, partnership, perseverance, I think we can accomplish almost anything.
This award, we appreciate so much. We care deeply, as you have heard from my fellow Grants Keysmo colleagues, about how we're passionate to drive change and be champions of that change to help agencies deliver on their grants mission. If I leave you with anything today, it would be that we ask that you continue being champions of change. If you or your agency or your friend or your neighbor, if they are within the federal government and they have a need for some sort of grants technology, please send them to us. We want to make your life easier so that we can make the lives of individual members of the public make their lives easier when they come to the government, to our systems to do business with us.